LeFlore. I'm here with Mohan Nathan. Thank you so much for being with us here today.
Thank you for having me.
Well, great. Tell us a little bit about your startup you're with.
I'm with TransEnterix, which is a medical technology startup that's advancing surgery through innovation. Our primary product is something called the Spider Surgical System, which is a innovative device that actually goes through a small hole in a patient about the size of a dime, and then the surgeon's able to open it up like an umbrella, giving them multiple flexible arms and the operative field and the vision to be able to do the surgery. They do the surgery using flexible instruments through these arms, and then at the end of the surgery it actually closes up like an umbrella and comes out through that same small incision. So it reduces the number of incisions a patient usually has to undergo by quite a bit, from like 4 or 5 down to 1, and hopefully makes it for a much quicker recovery and a better experience for them and the surgeon.
Wow, that's exciting. It sounds like there's a lot to do. How did you get into the medical device industry yourself?
You know, I originally started in IT, and I started a company in IT when I first got out of undergrad, and that was a lot of fun. But I think I found that, for me at least, I felt very removed from things that really matter to me and that moved me, you know, sometimes dealing with behind the firewall software and things like that. And so I had an opportunity when I went to business school to sort of look at sort of different industries, take a moment and really think about what motivated me. And I've always been very interested in science and medicine, and it was a perfect marriage for me. The complexity of the business, the fact that it can actually impact real patients' lives, and there's just never-ending places to go with the science and medicine and medical technology. So it's a great thing that just motivates me a lot. So that's what brought me to it.
Wow, and the medical field sounds very complex. What advice would you give to entrepreneurs who are specifically trying to enter that field?
Yeah, I think that's a really good observation about its complexity. And my first piece of advice is to find a way to cut through the complexity. It's amazing how you can get lost in it, and a lot of people make their living actually trying to advise or guide or just, you know, live in that complexity. And I think sometimes that can really gum up the works of a startup or even just your head, and trying to make the right decisions in a business environment that's fast moving. I think you really have to stop, take a deep breath, and actually clear away a lot of the complexity and think about what are the simple things that we have to do to succeed as a company and to drive value for our customers. And those things are sort of universal, whether you're an internet startup or a big company or a medical technology company. The customers are different and the products are different, but the basic rules are the same. And, you know, are you meeting a need in a really innovative way? How are you bringing value? Is this something that your customer can understand quickly, or does it take you, if it takes you 30 minutes to explain it, and that tells you something, that's, there's the clarity of that value is just not there. And so I think the simple things really hold true in medical technology, and I think too often people look at that space and the complexity of reimbursement and payers and the science, and they just get lost in it, and they think that they can focus on one of those complex aspects of it, and they sometimes lose sight of those fundamentals, which usually really do determine whether a company is successful or not.
Wow, okay, so there's a lot to it then.
Yeah.
What are some pitfalls that you would advise to avoid in the medical device industry?
Yeah, I think probably the first thing would be, there's this sense within the medical device industry is that you've got to get big fast, and that you've really got to have a large sales force to be able to get to as many physicians as possible. We have a very Byzantine healthcare system in the United States, and we're also selling in Europe as well, and so there's complexities with every country and the differences in their medical systems and the role of government in those systems. But a lot of people feel that you've got to get big fast, you've got to get a lot of feet on the street, and I actually feel like the best thing to do is to, at least initially, not fall for that and feel like you have to grow big so fast and have a lot of expenses and have a lot of people on the street. It's better actually to sort of keep it small, where the communication can be really strong. You can be talking to surgeons, talking with a few elite salespeople that really understand the market and understand being in the OR environment and being consultative and working with surgeons to kind of figure things out. And you can learn with that smaller team. And then you may have something that you can say, okay, let's rinse, repeat, and let's go out there and sort of get this in the hands of a lot of surgeons. And of course, that does require people that can actually meet with those surgeons, be in those hospitals. It does require that kind of large framework. But I think it's a mistake to feel like you have to get there first before you kind of figure things out with a smaller, more elite team, because with a large group, I think the communication really breaks down. You're talking at one another, sales and customers at sort of the people inside the company. It's far better to have a smaller group, smaller number of customers, smaller number of salespeople, and really figure things out and then go big.
Okay. Well, sounds like you've been doing this for a while and have a lot of great experience in that realm. What advice would you give, wrapping up now, or an inspirational story that you'd like to provide to entrepreneurs out there on how to help grow their business?
Well, I think probably the biggest thing that I've learned is just how important it is to find one thing and again, back to the complexity argument, and just find one thing, particularly in medical technology, that really makes a difference, and be doggedly determined to understand and explain and demonstrate the value in that one thing. I can give you example after example from my own career and just watching the medical technology industry, where it's far better to sort of pick one procedure and one clinical problem and just address that and provide value at that, and then things can go from there. Too often I think we look at medicine and say, wow, there's all these places we can go with it, and our product can be used in 15 different surgeries and in 15 different ways, and it changes things in 10 different areas of the surgery. And it's far better to say, you know what, there's this one aspect of this procedure where it's really difficult to bring two vessels together and really seal them appropriately and suture them in place, and that's the one thing that's clinically very relevant to the quality of the procedure, and we're really addressing that with this technology, and in a cost-effective way that's going to be good for the patient, and that's the one thing we're doing, and let's demonstrate that. And I think that one thing is so important to get right, and then you can go from there. Far too often people think, in order for my company to be successful, I have to show how I can change the world on 15 different aspects. And don't try to do that in medical technology. One thing at a time.
Okay, well, great. Thank you so much, Mohan.
Thanks for having me. Appreciate it.